Dengue. Uh, Main causative agent for dengue is the group B arbovirus. Like a vector for dengue is Aedes aegypti, and reservoir for that is man or Aedes. Mainly incubation period for dengue is 3 to 10 days. Then dengue in dengue fever, virus is RNA, also known as break a bone fever. In that patient having severe body pain, mainly at back, that is transmitted by aegypti. And main clinical features in dengue fever is sudden onset fever, severe headache, that is retroorbital, muscle pain, anorexia, nausea, vomiting, epistaxis and ecchymosis, and maculopapular rash. The rash of dengue fever in the acute stage blanches when pressed. The rash that commonly forms during the recovery from dengue fever is classic island of white in a sea of red. Dengue is classified as uncomplicated dengue fever in that patient having nausea, vomiting, pain. In complicated dengue fever, there is severe bleeding, severe plasma leakage, and severe organ dysfunction. Severe dengue is identified by the detection of bleeding tendencies like in tourniquet test or petechia. Bleeding tendency due to thrombocytopenia occurs in these patients. That's why having petechia spot in the body, platelet count is reduced. In a severe dengue, there is one term is dengue hemorrhagic fever. It results in bleeding due to low level of blood platelet. Overt bleeding occurs in the absence of underlying cause such as pre-existing gastrointestinal lesion. Now, how to one more thing is dengue shock syndrome. A systolic in that systolic BP is less than 90 millimeter of mercury due to hypovolemic shock. In dengue shock syndrome, there is a hypovolemic shock, signs of dehydration, septic shock, anaphylaxis shock, cardiogenic shock, that is diagnosed by IgM ELISA test, RT-PCR. Then in treatment, we treat patient symptomatically. For fever, we give NSAIDs like PCM. Not aspirin is not recommended in these. Oral dehydration. If in shock, give IV line fluid. If bleeding, blood transfusion. Then for like that's all about the dengue.